Hi, today I'll be talking about in vitro fertilization, also known as IVF. In vitro fertilization treatment is an assisted reproductive treatment procedure that involves fertilization of a sperm and egg outside the body and the placement of the embryos inside the uterus. In 1978, the first IVF baby, Louis Brown, was born in Oldham, England. Patrick Steptoe and Robert Edwards were the ones that achieved their first IVF pregnancy and birth. The first Australian IVF birth was in 1980, and the first IVF surrogate birth was in 1989. The following is a YouTube link as a video showing the IVF procedure, explaining it step one by one. IVF treatment is used by couples or individuals who are having difficulty conceiving naturally due to infertility or other health issues. Some of the reasons couples choose IVF treatments are age, same-sex relationships, poor or low sperm count, genetic disorders, and ovulation disorders. It is standard practice in Australia for couples to have failed to conceive naturally after 12 months or more of trying. Some of the issues associated with IVFs are the storage and fate of the unused embryos, sex selection, choice of the embryo traits, the motive, the quality of consent from both parents, high rates of multiple births associated with IVF, and also high rate of risk of miscarriage. The cost, affordability, and effectiveness of procedure, access to donors and surrogates, which at times can be challenging and difficult to access, support during treatment if something goes wrong, example, counseling, and access to treatment. Has it always been legal and ethical? Well, IVF treatment is when an egg, sperm are joined out of the body and then implanted inside the uterus. Churches oppose the treatment because it is a synthetic form of conception, as it is out of the body, therefore making the marriage immoral and not sacred, and involves masturbation, which is considered immoral. The destruction of unused embryos, in which the church believes is a soul, must be treated as one, and the IVF industry placing profit over patients. How does the issue compare Melbourne to the rest of Australia? Well, Victoria's got a few legislation, and first one is the ART Act 2008, Victoria, and it is to regulate the use of the ART, control access to information about treatments carried under the Act, promote research into the incidence, causes, and prevention of infertility, to make provisions concerning surrogacy arrangement, to establish Victorian ART authority, and to provide the keeping and central and voluntary register by the ART. Clinics and donor register must record the ART Regulation 2009 and ART Act 2008 outlines requirements for counseling concern expenses that may be reimbursed to a surrogate and information. A new legislation passed on the 4th of June 2020 by the government of Australia, Victorian government, removes the mandatory police and child protection order for people wanting IVF treatment and making it easier for many people to access. These are the current Victorian legislation compared to the rest of Australian states and territories. So in Victoria, the ART Amendment Act 2016 and the ART Regulation 2009 and ART Act 2008 and recently the ART Act 2020. Well, New South Wales, they have the AR Technology Act 2007 and the AR Technology Act in 2014. Western Australia have Human Reproductive Technology Act in 1991, Human Reproductive Technology Act 2004. Australian Capital Territory, they currently have no legislation act that regulates the ART, so it's the Northern Territory as well, and Queensland. Tasmania as well have no current legislation act that regulates ART. South Australia has ART Act 1988 and ART Regulation 2010. How does this issue affect the general community, healthcare workers, and patients and their families? IVF can be psychologically demanding and emotional for the patient and their families. Women usually experience symptoms of depression while awaiting further results or when the treatment fails. For some couples deciding to stop treatment, it can be challenging and extremely stressful and hard. Couples with frozen embryos as well find it challenging to decide what to do with the embryos when they no longer intend to use them, whether to destroy it or to donate it. And families of those undergoing treatment can sometimes find it stressful. Just having a family member going through this process can be very challenging for the rest of the family to have to witness. Does this issue require the nurse to make individual choices or put the nurse in a situation where they may feel uncomfortable? IVF nurses are more counseling based than ward. They build relationship with the families, patients, and bond with them. They offer emotional support for those who wish to not tell their families and friends throughout this journey. Having to deliver good news is so rewarding, but having to let the patient know that the treatment has failed can be heartbreaking for some of the nurses to do. The nurses refer to counseling if patient needs more help. They do take pregnancy tests, perform insemination procedure, perform ultrasound, and take blood or hormones. The frameworks of ethical decision making for nurses relevant to this situation, and do the ethical standards provide guidance? The frameworks of decision making to guide nurses to be able to make decisions relating to the scope of practice and delegation to provide consistent, safe, evidence-based, and person-centered care across the nursing profession, according to Australian Nursing Midwifery Federation. The framework for decision making provides consistent approach to nursing in all aspects. When it comes to IVF and ART treatment, it is more complicated and much complicated, but the framework ethical decision making guides the nurse in making professional person-centered care, and Thank you.